Diabetes mellitus. First introduction. Diabetes mellitus is a chronic metabolic disorder that characterized by the elevated blood glucose level. It's called as hyperglycemia, resulting from either insulin deficiency or insulin resistance. Okay. Types. We have two types. Okay. Another one is fetal one. We'll see later it. Type 1 diabetes mellitus is a juvenile onset, usually diagnosed in the children, also in younger adults, considered as an autoimmune disease. But in few patients, it's an idiopathic disease. Okay, no cause for that. It's a condition pancreas does not produce the enough insulin to the patient has to be taken insulin for the rest of their life to regulate the blood glucose level. Next, type 2 diabetes mellitus is a mature onset. Okay, it's also called as. Next, the body does not produce enough insulin, or the cells on the body does not react to the insulin. It's also called resistance, insulin resistance. The patient need oral hypoglycemic agents to regulate the blood glucose levels. Diagnosis. This is normal. First, fasting blood sugar should be 60 to 100 microgram per deciliter, and the post prandial blood sugar level should be 160 to 180. And if this fasting more than 125, it's an ill condition. If this post prandial is more than 200, it's considered as diabetic condition. There is another test for diagnosis also for that is HbA1c. This is for 3 months. One test of that is also called 3-month sugar test. 6.5 is normal and more than 7 is that diabetic condition. Symptoms of this diabetes mellitus: firstly, urine, increase the urine, right? Next one is polyphagia. It means more, they want to eat more. And polydipsia, it means more thirst, they want to drink more and more water. Glycosuria, glucose in the urine. Okay. Next, polyuria, more urination. We discussed it, right? Next, insulin is a pancreatic beta cells that secrete insulin. Insulin is a 2-chain polypeptide having 51 amino acids in it. Molecular weight is 6000 approx, and A chain contains 21 amino acids, B chain contains 30 amino acids. They are attached together by the disulfide bonds, and insulin synthesized beta pancreatic cells such as a single peptide pre-proinsulin. Okay, pre-proinsulin. This is pre-proinsulin to proinsulin, proinsulin to insulin. This is by this conversion is by liposomal enzymes. This insulin plus C peptide cell GLUT4 transporter, glucose enter, glycolysis, ATP increase, so that stopped by this. So potassium sensitive adipase channel, calcium increases, depolarization occurs, so that the insulin releases into the blood.